the hard palate with the rugae, the soft palate, the epiglottis, the glottis, the opening of the esophagus, the tongue. We have the larynx, the trachea is this, and underneath it we have the esophagus and the lungs. That's the spleen. Here's the stomach. Between the two is the lesser omentum. The large one is the greater omentum. The pyloric sphincter, duodenum. Within the mesentery is the pancreas. Duodenum at the curve turns into the jejunum, going on into the ileum. The large intestine starts with the ileocecal sphincter connected to the cecum. We have the ascending, transverse, and descending colon, which leads into the rectum. The kidney, above the kidney, the adrenal gland. Below the kidney, connected, is the ureter, which comes down here to the urinary bladder. Below the urinary bladder is the urethra. The ovary, the oviduct, the horn of the uterus, the body of the uterus, connected to the vagina, the urethra. The two come together at the urogenital sinus, which is right here. Also the vaginal orifice. And where was the vas deferens again?
It's on both sides there.
Okay. And where does it, the ureter that connects it to the kidney,
All right.
that goes up towards the top?
That's right here.
Okay. So it looks a lot like the vas deferens, but it goes up to the kidney. Okay.
That's not the vas deferens. That's just a vein. So this is the vas deferens on this side.
Oh, okay, that little teeny thing. Okay.
And then is this? And then
here.
In the heart, we have the right atrium, the left atrium, the right ventricle, and the left ventricle.
Start at the heart with the aortic arch, and you have the pulmonary trunk, which goes to the lungs. This is the brachiocephalic artery. This is the left subclavian artery. Goes up to the common carotid artery, that's the right one. This is the left common carotid artery. Over here, okay, we have the brachiocephalic artery, the left subclavian artery, which leads up to the axillary artery. Goes down into the subscapular artery, and past that point is the brachial artery, all the way to the arm. This is the superior vena cava. It splits into the right and left brachiocephalic veins. Then it forks up to the right and the left external jugular veins. This goes off to the subclavian. This is the left subclavian vein. After the left subclavian vein is the axillary vein. Goes down. Here's the subscapular vein, and going out towards the elbow is the brachial vein.
We have the thoracic aorta coming down as it goes through the diaphragm, comes up. This is the celiac trunk. From the celiac trunk, it goes up here. It branches to the right. The first one is the hepatic, then the gastric, we're talking arteries, and then the splenic artery. Come back down here to the aorta. As you're coming down, the next one is the superior mesenteric artery right here. Continue to follow down. You end up at the renal artery. In the arteries, we have coming down the abdominal aorta. Coming off of it just before the leg splits off, we have coming to the back the iliolumbar artery. Coming back down, going towards either leg, the first thing we come to is the external iliac artery, which turns into the femoral artery. Coming back up here, right after the break off for the external iliac, if you continue down, we have a split here. This is splitting to the internal iliac artery on both sides. Going deep within the tail, we have pointing right down there, it splits down into the caudal artery.
Okay, we have the inferior vena cava that comes down from the heart. It goes out, and you've got the adrenolumbar vein right here across the adrenal gland. Then we have the renal vein that goes out to the kidney. Continuing down, we have a split right here, and you've got the common iliac vein right here. So, and then going down into the external iliac, down into the femoral vein. Right here, you've got a split down into it goes down to the caudal, which is in the tail, but you've also got the internal iliac vein on both sides.